Assalamu alaikum. Hello my students. Hope you are fine. Today will be the final part or the last part of joints presentation. In the previous classes or 3 lectures, you have learned the different type of joints. Today we will discuss about the morphological classification of the joint. Morphological classification depends on the morphology of the articulating surfaces. So in this variety, we will learn about the organization, that means the structural organization, their peculiarities, and obviously the way they moves. We will talk about the morphological classification of the synovial joint because they are the maximum amount of joint present in our body. As you know that the synovial joints are movable joints. With these kind of movements, we cannot do any locomotion. In fact, we cannot do anything. So joints are very much useful. Without using the joint, a person cannot do anything. At the same time, this world will stop working without doing anything. So we will learn that what are the different types of movement we usually do daily to change this world. With some pictures, diagrams, and some animation, I will show you the different type of morphological classifications of the synovial joint and also the different types of movements that can happen in our body parts. So let's start. Welcome back again. So today we will start from the morphological classification of the synovial joint. The morphological classification of the synovial joint mainly depends on the morphology of the articulating bone. That means the morphology of the articular surfaces. On that basis, it is classified into plane or arthroidal joint, condylar or condyloid joint, saddle or sellar joint, pivot or trochoid joint, hinge or ginglymus joint, ellipsoid or ellipsoidal joint, and the very common ball and socket or spheroidal joint. Now what is plane joint? In case of plane joint, the articular surfaces are flat or plane. They permit the bones to slide upon each other. That means one bone is gliding upon another bone. The examples are intercarpal joint, intertarsal joint, acromioclavicular joint, articulation between the articular processes of vertebra. Some of the joints are very much known to you already as you have finished the super extremity card. Here is a picture and the animation we can see. This is the picture of the carpal bones. You know the intercarpal joint, that means the joint in between the carpal bones, and the midcarpal joint, that means the joint in between the proximal row and the distal row. The joints are basically plane type of synovial joint. We can see over here the surfaces are very much plane, and in this animation we can see one plane surface is gliding on another plane surface. Then the hinge joint. This joint resembles the hinge of a door. One articular surface is convex like cylinder, other one is reciprocally curved. This kind of joint moves around the transverse axis. They are mainly uniaxial joint. For example, interphalangeal joints of fingers and toes, elbow joint and ankle joint. In this picture we can see the example of hinge joint. Over here we can see this is the elbow joint. It is moving like the hinge of a door. From this animation we can understand how the hinge joint is working. If you notice, the distal part of the bone is moving basically. The proximal bone is fixed. At the same time, it is moving in the one direction. that is the transverse axis. Then pivot joint. One bone acts as a pivot which is encircled by a osteoligamentous ring. Either pivot rotate and the ring is fixed, or ring rotate and the pivot is fixed. Movement occurs in vertical axis. It is also a uniaxial joint. For example, atlantoaxial joint. Here the pivot is the dens of the axis or the second cervical vertebra, and the ring is the anterior bony arch and the transverse ligament of the atlas. Another example is proximal radioulnar joint, where the pivot is the head of the radius and the ring is the radial notch of the ulna along with the annular ligament. Let's see a picture. Over here we can see this is the ulna and this one is the radial notch of the ulna, where the head of the radius is attached, and the head of the radius is fixed with the radial notch of the ulna by the annular ligament, where the radius is moving in rotation. In this animation we can understand the movement of the radius. So this rotation is happening in the vertical axis and it is a uniaxial joint. Then the condylar joint. Each bone consists of two distinct articular surfaces, each known as condyle. Two convex condyle of one bone articulates with two concave condyles of another bone. The name itself says that this joint is happening in between condyles. The pair of articular condyles may be enveloped in the same articular capsule, for example knee joint, or in separate articular capsule or joint capsule, for example temporomandibular joint. The movement mainly occurs in transverse axis, so it is a uniaxial joint. Sometimes it may occur in the vertical axis, which is also present in the knee joint. For example, in case of knee joint, the main axis is transverse axis, and sometimes knee joint use another axis that is called the vertical axis to rotate a little. So in case of knee joint, it is called the complex, compound and condylar variety of synovial joint, and it is a modified type of condylar joint because condylar joint are mainly uniaxial joint, but in case of knee joint, as it use the vertical axis a little bit during the extension, that is called the locking and unlocking mechanism of the knee joint, in that case as it use a little bit vertical axis, so it's not purely condylar joint, it can say that modified condylar joint or modified hinge joint sometimes. Here is the example picture of a condylar joint. We can see this is a knee joint with the condyle of the medial condyle of the femur and the lateral condyle of the femur, which are convex, we can see, and it is articulating with the superior surface which is concave of the tibia. So this is a condylar joint. Now the ellipsoid joint. One articular surface is convex and elliptical in outline, and the other articular surface is concave and reciprocally curved. Movements occur in transverse and anteroposterior axis. So in case of elliptical joint or ellipsoid joint, it is using two axes to do the movements, transverse axis and the anteroposterior axis. So obviously these joints are biaxial joint as they are using two axes. The examples are radiocarpal joint, which is commonly present in the wrist joint, metacarpopharyngeal joint, atlanto-occipital joint. In this picture and animation we can understand one surface is convex and another surface is concave, and this surface allowing two axes of movement. We can see the movement of the two axes. Rotatory movement, which is showing over here, are not that much significant, which is very much common in the ball and socket type of synovial joint. Again, the ridge joint we can see scaphoid and the lunate and the lower surface of the radius, which is the ridge joint. This is a ellipsoid variety of synovial joint. Now the saddle joint or cellar. In these joints, the articular surfaces are reciprocally concavo-convex and resemble as a saddle of a horse, or the saddle that is actually present on the back of the horse to ride on it. You have seen that. They are biaxial joint as well. Examples are first carpometacarpal joint, sternoclavicular joint, and calcaneocuboidal joint. In this picture we can see the carpal bones again, as you have finished the super extremity, so I preferably giving you the pictures of the super extremity as for your convenience. You can see over here this joint is the first carpometacarpal joint, which is the joint between the trapezium and the first metacarpal bone of the thumb, and you already know that this is a saddle variety of the synovial joint. Can you see that convexo-concave or concavo-convex surfaces are reciprocally present in the two bones? Over here we can see the animation of a saddle joint. Now the last one, but the most important one, a ball and socket type of synovial joint. In this joint, a globoid head or ball of one bone fits into a cup shaped or socket shaped articular surface of another bone. Movements occur in three different independent axes. More than two axes are always multi-axial joint, so ball and socket type of joints are multi-axial joint. The axes are transverse axis. We know that in the transverse axis the movement are flexion and extension. Then anteroposterior axis, the movements are adduction and abduction. In case of vertical axis, the movement will be medial rotation and lateral rotation. The examples are shoulder joint, hip joint, and talocalcanonavicular joint, which is an incomplete type of ball and socket variety of synovial joint. We can see over here, this is the hip joint, this is the acetabulum of the hip bone, and this is the head of the femur, which is the ball. The socket is the acetabulum of the hip bone. So the movement can be in the various extension and the various degree and the various direction. We can see over here, this is the ball and this is the socket. The movement is happening in all direction. This is the actual picture of the hip joint, where we can see the real ball, that is the head of the femur, and also the socket, which is the rim of the acetabulum over here in the dissected body, obviously. Now in short about the blood supply of joints. The blood supply is carried out by unnamed arterial plexus. They are commonly regarded as periarticular arterial plexus. Circulus vasculus, they are also known. These are the small blood vessels or the minute blood vessels which are mainly coming from the systemic arteries which are present close to the joint. And these arteries first pierce the articular capsule and ultimately they ends at the synovial membrane. We know that intracardicular structures are mainly avascular. So this blood supply is only present up to the synovial membrane, and from this membrane, by the process of diffusion, the articular cartilages and the interarticular structures are getting their nutrition. Now the nerve supply of joint. There is a law called the Hilton's law regarding the nerve supply of the joint. The law states that the nerves which supply the joint also supply the group of muscles regulating the movements of that joint and the skin overlying that joint. So it is quite interesting that the same type of nerve supply, that means the same nerve root value they are having, these nerves are not only supplying the joint but also supply those muscles who are actually acting on that joint, and obviously the skin which is present over that joint are also supplied by the same nerves or their cutaneous branches. Articular capsule and ligaments have rich nerve supply, obviously, but synovial membrane has no nerve supply. Now we will see some of the movements. In Bangladesh and in some medical colleges, I do not know, the movements are not that much clearly shown, but we are learning from the international aspect, so we know that it is not only about the typical terms like flexion and extension. There is also a term called the hyperextension. You should know it. Flexion is the decrease the angle of a joint. We can see the flexion of the elbow joint. Then extension is the straightening and the returning the anatomical position of that joint. That means when you make your joint not bending but more straight. That is the extension. We can see the extension of the elbow joint over here. But in some cases, the extension can be more than its normal position, which is called the hyperextension. Extension beyond the 180 degree. For example, in case of your wrist joint, your normal position of your hand is the extension already. When you flex your wrist, this is called the flexion, and you know that you can bend your extended wrist a little bit more, and which is called the hyperextension. This is the picture of the shoulder joint. We are doing the flexion. When you return back your whole upper limb to the normal position, which is called the extension, and when you go beyond the normal position, it is called hyperextension. In case of hip joint, this is the flexion, and in case of knee joint, this is the flexion, and returning back to the normal position is the extension. Now abduction and adduction. Abduction is movement of a part away from the midline. The more you are pushing your limbs away from your body midline, that is called the abduction. Hyperabduction is the raise of the arm over back or front of head. So this is the adduction. The more you are going, it is the abduction of your shoulder joint, and when you go beyond this 90 degree, which is hyperabduction. Now adduction. You can see from the abduction position when you are returning back to your normal position, which is called the adduction. Hyperadduction can be done by crossing fingers. Then elevation and depression. Elevation is the movement that raises a bone vertically. That means when you move your bones above, which is called the elevation. For example, mandibles are elevated during biting and clavicles during a shark. We can see over here that person is shrugging. That means elevating his shoulder along with the clavicle. Depression is the lowering the mandible or the shoulder. we can see over here. We can see the movements of the mandible in another picture, but we can see the movement of the shoulder basically. When you depress your shoulder, that is called the depression. Then protraction and the retraction. Protraction is the forward movement on horizontal plane. We can see the shoulder joint. It is the person is pushing something forward on the horizontal plane. This is called the protraction. That is, sometimes it can be thrashing the jaw. We will see another picture to understand that. And shoulder and the pelvis forward, that is called the protraction. That means moving something forward is protraction. Retraction is the movement backwards on horizontal plane. Like we can see the shoulder joint is moving backward. Thrashing the jaw, shoulders or pelvis backward. We will see picture for the jaw. This is called the circumduction, the movement in which one end of appendages remains stationary while the other end makes a circular motion. We can see that appendages means over here the upper limb, and your trunk is fixed, but your upper limb is actually moving in a circular motion. This is called the circumduction. Already know the movement of the circumductions of your upper limb, and circumduction is only present in the ball and socket type of synovial joint. As we can see over here, this is the shoulder joint, that is the ball and socket type of synovial joint. The person is moving her hand in a circular motion, so this is a circumduction. All type of movements is present over here, like flexion, abduction, extension, adduction, and all movements. Usually the baseball player winding up for a pitch, like baseball player. If you see the baseball game, or if you see the cricket game, that when the person is throwing a ball, maybe you have seen that they are actually rotating their shoulder joint while they are just bowling. In case of baseball, it is called the pitching. Now the rotation, basically the movements happen in longitudinal axis, and obviously rotation can happen in the trunk, it can happen in the thigh, and it can happen in the head, and even on your arm. So over here we can see the rotatory movement of the shoulder joint and the hip joint as well. Over here we can see that the medial rotation is happening of your shoulder joint over your hip joint, and the lateral rotation is happening to the opposite direction. Medial rotation is actually inward movement, you can see, towards your body, and outward rotation is called the lateral rotation. This is the lateral rotation of the hip joint and the lateral rotation of the shoulder joint, and we can see that both of them is happening in the ball and socket type of synovial joint. Then the supination and the pronation, it is mainly happening in the forearm and also in the foot. We are using the supination and the pronation basically in the upper limb. We can see supination, the rotation of the forearm so that the palm faces forward. We can see the palm is facing forward. It is the supination, and you can see the direction of the supination. And the pronation, when the palm faces backward or rear. That means the way you are moving your palmar surface of your hand backward, that is called the pronation. We have demonstrated this movement in your classes. Then the movements of the foot. Dorsiflexion, you can see this is the foot, and this is the dorsal surface, and this is the plantar surface. So when you are pushing your dorsal surface above, and this is called the dorsiflexion obviously, and when you are moving or pushing your plantar surface downwards, that is called the plantar flexion, and this is the neutral position or the zero position. So dorsiflexion is raising the toes as when you swing the foot forward to take a step like heel strike. During walking we always put our heel first, then our toes. So this is the dorsiflexion is very much important when you are walking. Plantar flexion is extension of the foot so that the toes point downwards as in standing on tiptoe. Sometimes when you are taking something from a very high area, sometimes you need to put your sole of your foot like this, so that you are pressing on your toes to raise yourself to get that thing. So that is the plantar flexion. We use it while we are actually
try to grab something from a higher areas, you know that, to increase your height, right? Now the inversion, this is very interesting. Inversion, we can see that actually your sole of your feet is facing medially. That means your medial border of your feet is elevated while the lateral border of your feet is touching the floor, is raising the medial edge of the foot where the sole faces medially, we can see over here. Then the eversion is the raising the lateral edge of your foot, just the opposite thing, the sole is facing laterally. Here the medial border is touching the ground and the lateral border is elevated. This kind of movement is actually happening when you are walking in any uneven surfaces, right? These are the movements of the head and the trunk. This is the flexion. You can see your trunk is bending forward. Actually, this example is very common when you are coming to the teacher and you are signing your histology khata, right? And this one is something then when you are seeing a notice board, hyperextension. And this movement is very common when you are seeking permission to enter into your teacher's room, right? This is very funny. Lateral flexion. Now the rotation of the trunk and the head. The person is rotated laterally, even his feet is placed very much fixed on the ground. This kind of movement is happening when someone is calling you from the side or the back. Suddenly you are rotating yourself. This is the right rotation. And sometimes when your body is fixed and your head is only moving to right and left side, that is the rotation of your head. The movements of the mandible. It can be elevation, that is the upward movement of the mandible, we can see when you are closing your mouth. It can be depression when you are opening your mouth, that means pushing your mandible downwards. It can be forward movement, that means you are pushing your mandible forward. It can be backward movement of your mandible. Seems like you are very much upset. Sometimes when you are chewing something or you are grinding something in your mouth, then sometimes your mandible is moving side to side. Then the movements of your hand and digits. In the wrist joint, sometimes you can flex your hand laterally, that is called the radial flexion. Sometimes you can do it in the ulnar side, that is ulnar flexion, when you are waving your hand to say someone bye. Sometimes you can abduct your fingers, that means you are actually pushing your fingers away from the midline and there is a gap in between the fingers, that is called the abduction of the fingers. And when you are returning back it to normal position, then it's called the adduction of the fingers. Very important and interesting movement happens in the thumb, that is called the opposition, when you are trying to touch the every finger tip through your thumb, that is called the opposition of the thumb. And this is the abduction of the thumb, when you are moving your thumb away from your other fingers. Repositioning is the normal back to the it is actually repositioning of your thumb to its normal position, that is in the anatomical position, that is called the reposition of the thumb. So that's all from today. Thank you very much. And that was the last slide for today's presentation, and we already finished the joint. From the next class we will start the muscle tissue. Thank you.
So my dear students, that was the last class of joint. Hopefully in the coming days I will give you some of the questions from this topic that will help you out in your CURT, term, and obviously the professional examination. So don't worry. The next class will be on the muscle tissue. So I want you to study a little at your home regarding the muscle tissue so that you can understand my lecture properly. Also, it is very important that whatever you have learned in our joint lecture classes, you have to remember those things. Try to memorize the movements of the joints along with their morphologies while you are moving your joint so that you can remember them very easily. At the same time, I want you to know that in the coming days, whenever we will learn the muscle tissues, we will also know that how the muscles are working on this type of joints. So that is very important. We have to correlate the combined studies. So that's all for today. But last but not the least, again, be safe. Try to stay at home. Make yourself and your family members safe, and also try to save the society. Try to maintain your personal hygiene and pray to Almighty Allah so that we can get rid from this situation as early as possible. Thank you very much for your patience hearing. Take care.